Hello everyone, today we'll discuss about manual muscle testing for muscles of the trunk, that is lumbar and thoracic spine. So we'll be discussing about trunk extension at the lumbar spine, trunk extension at the thoracic spine, trunk flexion and trunk rotation. So first we will discuss about trunk extension at the lumbar spine. So to assess the manual muscle testing for lumbar spine muscles, trunk extensors, what should be the position of the patient? The position of the patient should be prone with hands clasped behind the head. So in this position, the therapist stabilizes the lower extremities just above the ankle, or patient can use his body weight or her body weight and both arms placed across the pelvis to stabilize the lower extremity. So in this position and stabilization, we will instruct the patient to perform extension of the lumbar spine until the entire thorax is raised above the table. So the point where we can know that patient has sufficiently extended the trunk is when the patient clears the umbilicus from the couch or the table. So here is a video demonstration where the patient is placed prone lying with hands clasped behind the head, and the therapist is stabilizing the lower extremity. Now we'll ask the patient to perform extension of the lumbar spine. So if patient clears the umbilicus sufficiently from the couch, then we can say that the patient has performed full range of motion of the lumbar spine extension. Now the grading system for the trunk muscles are different compared to the extremity muscles. Here the grading systems are subjective. For trunk extensors at the lumbar and the thorax, we grade differently. For trunk flexors and trunk rotators, we grade the MMT gradings differently. So let's check out the grading system for trunk extensors. So for grade 5, it means the patient is able to perform extension and come to the end position, that is full range of motion, without any evidence of significant effort. So patient is able to clear the umbilicus from the couch very easily without much effort. For grade 4, patient requires lot of effort to clear the umbilicus from the couch or the table. For grade 3, patient's arm position changes. So arm is placed by the side of the body, and patient is able to complete the range of motion in this position. And for grade 2, patient completes partial range of motion. So you can see there is a difference in grading system compared to extremity muscle. Here, to instruct the patient to perform the movement smoothly for trunk extension in eliminated gravity position is difficult, so the grading system is different. Now let's move on to trunk extension at the thoracic spine. So the patient is prone while the head and the upper trunk is extending off the table until xiphoid process of the sternum. Then the patient will be stabilizing the lower extremities at the ankle, and will ask the patient to perform extension of the thoracic spine. We will instruct the patient to raise their head, shoulders and chest to the table level. So here you can see patient is placed until xiphoid process out of the couch, and then we'll instruct the patient to perform extension of the thorax by raising the head, shoulder and the trunk, upper trunk, while the therapist stabilizes the lower extremity. So patient performs extension of the upper trunk, that is thoracic spine. Now let's move on to trunk flexion. So here again the grading system is different compared to trunk extension. For trunk flexion grade 5, the position of the patient is supine with hands clasped behind the head, and then we instruct the patient to perform trunk flexion by contracting the trunk flexors. So the patient performs trunk flexion until the scapula is cleared from the table. So So that is the criteria here for grade 5, that is the hand should be behind the head and both the hands clasped behind the head, and patient should be able to flex the trunk until the scapula clears the table. So that will be considered as grade 5. So here you can see the hands are behind the head and patient performs flexion of the trunk and clears the scapula from the couch while the examiner or the therapist holds the ankle or stabilizes the distal part of the body. For grade 4, the position changes here. The patient is lying supine with arms crossed over the chest. So for grade 4, for grade 5, the hands were behind the head. Here for grade 4, the arms are crossed over the chest and patient performs same movement, that is flexion of the trunk, until he clears the scapula from the table. So kindly observe the video here. The hands are crossed in front of the chest and the patient performs flexion. For grade 3, the position of the patient changes again. Here the arms are extended or overstretched in full extended elbow above plane of the body, and then the patient performs flexion of the trunk until the scapula is cleared from the table. So this will be considered as grade 3. For grade 2 and grade 1, the therapist will ask the patient to flex the knee joint so that the hip is relaxed and will palpate the abdominal muscles for trunk flexors, and will ask the patient to perform flexion and palpate the muscles. And if patient is able to perform partial flexion, then we'll consider as grade 2. And if there is only contraction of the muscle but no change in the range of motion, then we'll consider it as grade 1. Now coming to trunk rotation, the grading systems are similar to trunk flexors here. For grade 5 trunk rotation, we'll place the patient similar to grade 5 trunk flexors. Patient is supine with hands clasped behind the head. But the test movement here differs, where we ask the patient to flex the trunk as well as rotate to one side. And then we'll repeat the same test for the opposite rotators. So we have rotation to the left and rotation to the right. So this is the position for testing grade 5 MMT for trunk rotators. So the scapula corresponding to opposite side of the rotation must clear the table for grade 5. So in this picture here you can see the patient is rotating towards the left, so the right scapula should be cleared off the table. So the patient performs flexion and rotation to the left, checking the rotators of the internal oblique of the left and the external oblique of the right. For grade 4, again the position is similar to trunk flexors grade 4, position with arms crossed over the chest, and we'll ask the patient to perform flexion of the trunk as well as rotation to one side. So again in this position the patient should be able to clear the scapula of the corresponding to the opposite side of the rotation. So this is for grade 4 trunk rotation. So coming on to trunk rotation positioning for grade 3. The position of the patient is similar to trunk flexors for grade 3. So the position should be supine with arm outstretched above plane of the body. Here we'll ask the patient to perform trunk flexion with rotation to one side, and then we can repeat the test for rotation to the opposite side. So here again we have to check that the scapula clears the table while rotating to the opposite side. So this is the positioning for grade 3. We'll ask the patient to perform flexion and rotation to one side while the scapula of the opposite side clears the table. So these were the MMT testings and gradings and positionings for trunk flexors, extensors and trunk rotators. So if you have any doubt, you can ask me, and I hope you have understood by now that the grading system for trunk is different compared to the extremities. Thank you.